While the mainstream media condemns the use of ivermectin, the most populated state in India just declared they are officially COVID-free after promoting widespread use of the safe, proven medicine. Here's One America's Pearson Sharp.
Ivermectin is getting a pretty bad rap here in the United States, all over the Western world, really. And to be fair, that's probably for a good reason. I mean, it was developed in the 80s specifically for humans and was later found to be effective for treating animals as well, has been used safely for decades, has no known drug interactions, revolutionized healthcare in Africa and has saved millions of lives, won a Nobel Prize for its success treating humans in 2015, and is on the WHO's list of the safest, most effective medicines in the entire world. But sure, just repeat the leftist talking point, it's horse dewormer. The problem, as we've discussed, is that ivermectin is cheap and widely available, and it won't make Pfizer or Moderna $60 billion a year like selling the investigational vaccine will. But is there any evidence that it actually works to treat the coronavirus? Actually, yes, quite a lot in fact. In India, in the state of Uttar Pradesh, which has a population of 240 million people, the government has been widely promoting the use of ivermectin to treat Wuhan virus patients. And instead of headlines reporting thousands and millions of deaths from deadly horse medicine, state leaders have just declared that Uttar Pradesh is now officially COVID-free. A region with nearly as many people as the entire United States is totally COVID-free. And the recovery rate in India, which no one in America seems to be talking about either, is 98.7%. So let's compare for a moment, because we might be able to make an important discovery here for public health. In India's state of Uttar Pradesh, just 5.8% of the population are fully vaccinated. In the United States, nearly 60% of Americans are fully vaccinated. In India's state, the rate of COVID positivity is 0.01%. In the United States, it's 7.6%. In India, they have 199 active COVID cases. In the U.S., we have nearly 130,000 new cases as of September 30th, and an average of more than 112,000 cases in just the last 7 days. And in India, they're widely promoting the use of ivermectin to treat the China virus. In the United States, doctors will lose their medical license if they prescribe ivermectin, and our top so-called medical professionals dismiss the drug as nothing more than dewormer for barnyard animals. Do you see a connection here? And it's worth pointing out that Uttar Pradesh is India's most highly populated state, where people are densely packed together, much more so than here in the U.S., and it's impossible to practice proper social COVID distancing. So what does all this tell us? That maybe, just maybe, there's something to the claims that ivermectin can and does work against the coronavirus. But no, instead, you have the high prophet of pharma, the good doctor, Anthony Fauci, condemning it, and even major news outlets running fake stories about how 70% of Mississippi's poison control calls are for people taking ivermectin. That story turned out to be totally false, never happened, and the AP had to find a way to take their massive, jackbooted foot out of their mealy mouths and retract the story. Rather than saving lives, the political, medical, and media establishment are promoting false stories about a safe drug, claiming it will kill you, and instead promoting an untested, unproven drug that actually is killing young, healthy people with no underlying conditions, like 13-year-old Jacob Clinic of Michigan, who died 3 days after receiving the vaccine from fatal heart inflammation, or paralyzing others, like 12-year-old Maddie Desgaret, who almost died after receiving her second dose of the Pfizer vaccine and can no longer move her legs and is bound to a wheelchair, or Jumae Nachi, an otherwise healthy woman who had no symptoms before getting vaccinated and who somehow came down with COVID immediately after getting the Pfizer vaccine and had to have both her legs and hands amputated. Why should we trust our health officials when they won't follow the science? Americans are being lied to. We're being told not to believe the facts that we can see with our own eyes, while Big Pharma makes tens of billions of dollars profiting on the death and suffering of this pandemic. The simple truth is that our nation could open up today, like in India, without any need for more lockdowns, without the need for mandatory injections, without mask mandates for our children in school. All we have to do is follow the science. For One American News, I'm Pearson Sharp.
Want to see more videos like this? Visit OANN.com for immediate access to all the clips you've been waiting to see.